I think the influenza infection is actually serious in almost every state in the United States, but in the northern hemisphere, from October to March is when the epidemic usually starts. In the area, traditionally we have severe cases with not a lot of mortality, but definitely becomes an epidemic where children and patients with high risk factors, they really become vulnerable for increased morbidity and mortality. But it's very serious usually this time of the year. The influenza is an infection caused by a virus, A and B, influenza A and B. Symptoms are usually a lot more dramatic, and patients experience a lot more cough and fever, chills, pain. Other viruses that can cause similar infections are traditionally less severe, although some of them can be very similar in a way. The influenza infection definitely causes a lot more complications than traditional cold or other viral infections. Both of them are actually self-limited, so they usually get away, but they get better with time and just conservative treatment, a lot of fluids, some Tylenol. But again, the influenza has a lot more risk for increased morbidity and mortality. Increase of mortality usually is more in a high-risk population. Those are patients less than 5 years of age, more than 65 years of age, or patients with chronic conditions like diabetes, hypertension, heart disease, pulmonary disease, etc. The influenza infection gets transmitted from person to person mostly, although there has been some viruses that mutated, like from swine or birds, but mostly from humans, and they get transmitted by air droplets, and some of them can be big, some of them can be very tiny. The big droplets actually can be transmitted from less than 6 feet of distance if somebody coughs. The small one stays around for a longer time, and they can be also aspirated, and then you get the infection. So the way to decrease infection is definitely trying to decrease the exposure to people, family members or co-workers or general population from your cough. So cover your cough is very important. Wash your hands. Make sure you get the immunization against the influenza vaccine. Those measures definitely will decrease probably the transmission of it. So the influenza vaccination can be given anywhere almost in the area. You can go to the pharmacy, you can go to your clinic with your primary care provider. Even ER can give you the, or urgent cares have the influenza vaccine available for patients that never had it or didn't have it this year. It's important to, if you have the symptoms of influenza, to be checked as soon as you can, because the treatment for decreasing the length of the disease, which is available, is more effective on the first 48 hours of infection.